Hi, this is Dr. Paul Anderson from Peachtree Oral Facial Surgery. Most common questions that we get concerning areas of our practice would probably be, what is a dental implant? Probably the best answer is that it is a replacement for your natural teeth. That could be one tooth or that could be many teeth. To start off, it really doesn't completely replace the whole tooth. The implant itself is the part that anchors into bone. It's up to your dentist usually to replace the tooth on top of it, but they have to have anchorage in the existing implant that goes into bone. Most of these are made of very bio-friendly materials. One of those would be titanium or titanium derivative. We also have some zirconium out there as well. Both of those are very biologically inert and the body tolerates them very well. Most of these implants are there for a very long time. Dental implants many times will end up being permanent, but for the most part, we have to consider them long-term. As far as medicine is concerned, this is probably the longest term medical prosthesis that we have available to us in the body. So when you get a dental implant, if you take good care of it, you could probably expect it to last for your lifetime.